Hi, Bill D. Simone. James Fisher and I have known each other for at least a dozen years. Around 2014, we both spoke at a conference, and fortunately, I spoke immediately before James because if you want to look good, you do not follow James. He recently messaged me about the biomechanics of 5 exercises, actually, more like exercise groups. So we immediately exchanged messages on the topic, and when I looked back at them, I thought, not bad. I wonder what I could do if I had some time to prepare. And this is what I could do. Enjoy. The 5 topics are the leg extension machine and whether you should lift or point your toes during the set, whether a one-legged leg press would be helpful in protecting the lumbar spine, side bends, the safest way to do pec flies, especially on a machine, and shoulders. The first question has to do with the leg extension machine and if how you hold your feet matters. So your choices would be plantar flexion with a P for pointing the toes, dorsiflexion, which is lifting your toes up towards your knees, or some combination of each. James' suggestion was that he liked the combination of lifting the toes and straightening the knee, and I'm not going to argue with a preference, although I coach them differently. This is what I wrote about the leg extension in Joint Friendly Fitness. What I'm about to say applies to any brand name. So I suggest avoiding the X positions, the top left and the lower right, that include pointing the toes at the bottom and lifting them at the top. I suggest the opposite, the 2 check positions that include lifting the toes at the bottom and pointing them at the top. Here's why. The calf, the gastrocnemius, points the foot, and the muscle on the shin, the tibialis, lifts the foot towards the knee. If you lift your toes and straighten your knees, the gastroc is stretched over both joints. It goes taut because of active insufficiency, and it can interfere with straightening the knee, although the tightness of your particular calves may determine if you notice it. I know I do. The tibialis, which attaches below the kneecap, doesn't extend the knee or stabilize the patella directly. It stabilizes the foot while walking. Maybe it stabilizes the shin if the foot is planted. So at best, it indirectly helps the knee, in spite of what influencers may claim. The muscles that directly stabilize the kneecap are the vastus group on the right-hand side of the slide. Conventional leg extension machines don't load the foot, so the tibialis isn't really involved. I don't see that there's any harm to lifting or pointing your foot during leg extensions, but there's no benefit either. If you do want to address the stability of the kneecap, the conventional physical therapy is the terminal knee extension, not the quote leg extension machine, unquote. The point of terminal knee extension is to isolate out the rectus femoris and to try to only use the vastus medialis and lateralis in straightening the knee, and also to avoid loading a very bent knee. Because if knees are going to hurt from exercises, it's the higher compression that comes from loading deeper knee angles that brings it on. So in this demonstration, my hand on my upper thigh is to make sure I'm not using that part of my quads to lift the cuff. If you want to work the tibialis to avoid shin splints, for example, you have to load the foot directly. This device is a DARD, directly against and resisting dorsiflexion. Notice that my preferred finish in the top right is with a bent knee so that tightness in the gastroc isn't a factor. But I didn't realize that this device was hard to come by since I've had one for 20 years. So here's a quick video of using a cuff weight to do the same thing. And while there's a bit of incidental leg movement happening, the only muscle I'm actively using is the tib in front of the shin. The next topic, the isolateral leg press to prevent the hips rolling and losing the lumbar curve. James and I seem to agree that a deep squat or leg press, as shown in the X photos on the screen, where you can't maintain the curve in the lower back, is a bad idea. And in fact, outside of exercise, every institution's guidelines for spine safety contraindicate loading the spine in flexion. At its most extreme, you have flexion distraction injuries to the spine, and at best, you're just putting the vertebrae, discs, and ligaments in a very vulnerable position. So James is asking if a form of one-legged squat could be useful. Now, I include this slide because James mentioned it specifically, and you probably haven't seen one. It's not because the elite are hoarding them. The design is problematic. It might help protect the lower back, but there are too many other things that can go wrong. Having used it, loading the shoulders this way was very uncomfortable. Loading the bent knee to this angle, in spite of Jones' theorizing, is still excessive compression. And the negative cam, which dramatically increases the resistance torque as you approach lockout, can be a real problem if you straighten your knee too far and slip into hyperextension. Muscle torque in hip and knee extension decreases as you approach full extension. So all the negative cam did was put extra load on the bones and connective tissue and risk bending your knee backwards like a grasshopper. So without a station to provide a safe alternating leg press, you might be tempted to use a conventional leg press or a squat, one leg at a time. One good aspect of the duo squat is that both feet were loaded. With both feet loaded evenly, the weight drives the femurs evenly into the pelvis. So the pelvis itself is relatively stable, and these deeper muscles in the hips that you see on the screen use the pelvis as an anchor and stabilize the femurs as you do the exercise. Assuming that when you squat and leg press, your knees aren't wobbling inside and out during the rep. If you try to do a one-legged leg press with one foot completely unloaded, the weight drives the femur back into the pelvis, which is no longer stable and will shift around the spine, specifically the sacrum. These muscles will still try to stabilize, but without an anchor, they're going to be less effective. The loaded side will try to stabilize both the pelvis and the femur, and if they can't, you put your lower back, hip, connective tissue, etc. at risk. So for one-legged work, if you use a conventional leg press, the non-working side has to drive against something to keep the pelvis in line. Another way would be to use split squats. With both feet on the floor, your center of gravity drops between your base of support, and there's the stability for the pelvis. Again, with the pelvis as the anchor, the deep hip muscles can stabilize the femur. If you try to squat with one leg completely off the floor, your center of gravity would fall outside of your base, and your torso would start to spin around the weight-bearing leg. I guess you could practice one-legged squats just to say you do them, but to my eye, that becomes more of a stunt than a useful exercise. Side bends, a classic weight training exercise that definitely falls into the category things you can do with a dumbbell when you're young, and not the category things you should do to your spine as you get older. On the left, that's from Here's Power For You by David Manners. On the right, from the Nautilus Bodybuilding book by Ellington Darden. The justification for side bends had been to work the external and internal obliques. In mainstream fitness, side bends have been overshadowed by side planks. One bends the spine, and one prevents bending the spine. Now, with the advantage of much easier access to anatomy and biomechanics textbooks, it doesn't take too much research to learn that the external and internal obliques are considered prime movers in spine flexion. Notice that the external obliques on the left are more superficial and so have better leverage than either the internal obliques or the rectus abdominis. The consensus in the textbooks is that when both sides of the obliques contract at the same time, they create, quote, a powerful spine flexion. So if you do curl-ups or reverse crunches or an ab station, you are already training the obliques. And especially if you use a small twist in a curl-up, bringing your shoulder towards your opposite hip, because that's what happens when one side of obliques contract. The rectus abdominis, the conventional ab six-pack, even though they may burn during ab exercise, their main role is to prevent hyperextension of the spine. In other words, to keep you from bending backwards, which accounts for the prominence of planks in core work. Notice that none of the abdominal wall muscles pull directly against resistance in either the side bend or the side plank. The muscles that do are deep to the spine. Now look at the lower right, the second group of muscles from the bottom, the quadratus lumborum, and directly across on the lower left, the multifidus. Those muscles run directly against side bending. As the text says, all the deep muscles work as a group to hold the vertebrae in relation to each other, in other words, your posture. The concern is that since these muscles have such little leverage, they can easily be overpowered, and then you put your spine in the exact position you are training to prevent. And the older you get, with age-related changes to the discs and other aspects of the spine, the more delicate this becomes. Now, if you feel you have to train this function, your priority has to change from lifting heavier weights in side bends or holding longer side planks to protecting your posture and stabilizing your spine first. I'd suggest using precise form in sets of 90 seconds rather than failure. And if you don't feel it's enough, do another round of precise form, only say for 60 seconds, and so on, working your way down to 30 seconds. So here's some examples of appropriate exercises with a quick video demo next. A short range side bend, short time slide planks, holding one dumbbell in one hand for a farmer's walk or just standing, cable elastic walkaways to the side, the body blade to the side, and a cable elastic press out. So tighten your midsection. Start by keeping your fists close to your chest and walk to the side while you're keeping your pelvis and your shoulders level. You can make it harder by extending your elbows or taking smaller steps before you use a heavier weight or a thicker elastic. This is the press out. You start with a short lever with your elbows bent and your fists by your chest, and straighten your elbows, which creates a longer lever. And every time you do that, you have to make sure you keep your midsection tight to hold your posture. The last area we're going to look at is the pec fly in external rotation, specifically machine versions. Kind of a trigger for me, as I seriously injured my own shoulder, not on a pec station, but by putting my shoulder in abduction and external rotation and hyperextension and applying force through it. And when you look into sports medicine, especially on overhead throwing injuries, they are so clear that this is a mechanism for injury that I can't believe they still make these machines. But they do, so here's what to know about using them safely. This article is from Iron Man magazine from 29 years ago. I'm not seriously using a muscle magazine as reference. Even writers I liked like Menser and Zane were writing muscle myth, not anatomy and biomechanics. This is by Joseph Horrigan, a chiropractor and physical therapist, and I've tracked the concepts mentioned in this article directly to sports medicine and rehab textbooks. I think these articles were never collected. Fortunately, I kept my copies. So I'll read some excerpts specific to James's concerns about the pec deck station. Quote, "The final stretch position includes horizontal abduction or even hyperhorizontal abduction of the shoulder in figure 4 above." Quote, "When the shoulder is externally rotated, the ligaments in its front and bottom are stretched, and the stretch increases when the shoulder moves into horizontal abduction. This is not necessarily desirable. Too much stretching of the ligaments will make them permanently loose, and that will cause shoulder pains for a variety of reasons." Now, this is me talking. The way I've worked around this in 40 years of personal training is to coach, keep your hands in your peripheral vision. So if you keep your hands in sight, you have some margin for error, but if you can't see your hands, you're on the way to overstretching the shoulder. Back to the article. Another problem that seems to occur after patients use pec deck machines is known as thoracic outlet syndrome. The nerves to the upper arm leave the spine in the neck and form a bundle known as a plexus. The nerves in the bundle travel by certain muscles behind the collarbone, in front of the first rib, and past other muscles to supply the arm. If the bundle becomes compressed, the patient may experience tingling, numbness, pain, temperature differences, perceived or actual, and a variety of symptoms over large areas of the arm, forearm, hand, and even armpit. The pec deck can aggravate or produce this problem. Figure 3, in which he rolls his shoulder forward, a movement that protracts the scapulae. This position is the offending action. Don't let your shoulders roll forward when you're using the pec deck. And he concludes, the solution is to avoid rolling your shoulders forward during this machine, or simply avoid the machine altogether. The last area James and I spoke about is the shoulder, but I've already covered them in videos, so I'll put links in the description. You'll also find links to my books and free newsletter, so if you like this video, there's more where this came from. Please feel free to comment and we can continue the discussion. Now, a look at a technique from the upcoming Well Body Workout book, and quads.